So we're going to take some time going through the skull, and not going to lie, sitting here, I really feel like I should know some Hamlet. But we're going to dive in and get some practical advice on how to learn the names of all the fun parts here. As we start to work our way through the skull, be aware of the fact that the bones are split up into facial bones and then cranial bones. With the cranial bones, you'll be able to see where they're separated out by sutures. So sutures are where the bones grew towards each other, and it kind of leaves like a little jagged line where it looks like they're actually sewed together. So if we're going to switch from this model to one that's got all of these bones colored differently before we get into the names of each one individually. So as we can kind of see here, now we have where the color changes at the suture line. So here we have our frontal bone, which is going to basically be our forehead. So as you're learning the names of bones, relate them to yourself. So when you're touching your forehead, think, oh, this is my frontal bone. The frontal bone is separated from the parietal bones, which are the two in the back. The parietal bones are going to be the ones behind what we call the coronal suture. So the coronal plane being the one that splits you into a front and a back. We have a sagittal suture that will separate those two parietal bones. So there are two of them versus frontal, there was just one. A lot of our bones of the skull will have pairs. Behind the parietal bones, we have one that looks like a upside down V. The symbol for like that would be a lambdoid suture, lambda in Greek looks like an upside down V, and this is the lambdoid suture to kind of help show you that. The back of the skull, the bone here is the occipital bone, which also matches the name of the lobe of the brain that you're protecting, which is occipital there. As we flip it over, we can see that occipital bone reaches quite a ways. So anything in blue here, and it has a huge hole at the bottom. That hole is for the spinal cord to come out of the brain. This is called the foramen magnum. The language, again, needs to be translated to help it make sense and make it stick. So foramen means whole, magnum means big, so it literally translates to whole big. Surrounding the foramen magnum, you have two areas that look like a rocking chair, because that's exactly how it'll work. This will rock on what we call our C1 vertebrae. So these two arches here are for articulation, and C-shaped articulations are called condyles. So this is a condyle on the occipital bone to nod up and down to say yes. And so when we have condyles on a bone, you just name it for it. So we have occipital condyles. As we come over to the side, now this one in pink, this is the temporal bone. There's a lot off that temporal bone. If we flip it over and look at it from the inside, you can see it continues in. So there's that flat spot we saw on the outside, and then part that comes in, kind of making the bulkier part here. If we come back out, there are some major landmarks that you can find. Right here, you'll actually be able to feel it. So this right here is your hole for your ear. So if you put your hand right behind your ear, you should feel this bulky thing sticking out. I think of it as a massive process. That's the mastoid process. There's another one deep inside there you won't be able to feel. That is your styloid process, but it does look like a stylus. Kind of looks scary, actually. As we look at the ear hole, that's going to be called the external acoustic meatus. Again, with all of these structures, it's about translating the name. External meaning outside, acoustic for hearing, or auditory, sometimes you hear it that, and then meatus for tube. So it's literally translating to outside hearing tube. There is an internal that you would follow on the inside that would open into the skull. Now, when you're naming these processes, remember a process is a generic term for anything that sticks off. Sometimes you have processes that will reach out and touch another bone. When that happens, you name it for the bone that you're going to touch. So the bone here in yellow, that's the zygomatic bone. It actually has three processes. One here going to this bone, one here going to the frontal, and one here going to that temporal bone we just discussed as it reaches back. So how do you tell the difference between the three? You name it for the bone that you touch. So right here, this process is the temporal process of the zygomatic bone because it's touching the temporal bone. Back here, this is an extension of the temporal bone, but it's touching the zygomatic. So it's called the zygomatic process. So you're naming it for what you touch. If we look at the ones up here, this one reaching the frontal bone would be the frontal process of the zygomatic. This would be the maxillary process because this bone right here is the maxilla. So processes, if you have two bones meeting, you name it for what you touch. As we come around to the front, there are some tricks to the facial bones. You want to kind of always find a landmark too, and then they just roll in order. So if we start right here at the ones over top of the nose, that's the nasal region. Those are going to be the nasal bones. Then we have the maxilla that we just talked about that sneaks up here, meeting with that frontal bone. Then there's the lacrimal bone, has a little hole in there for tears to drain. So I always think criminals cry, like I didn't do it, I swear. Then we have our ethmoid bone that's making up the internal wall of the orbit or the socket. And then all the way in the back is our sphenoid bone. Sphenoid bone's an interesting one. It looks like an evil bat. Some books will tell you it looks like a cute little butterfly. I don't see it. That looks creepy. So this is actually sitting inside the skull. If we were to flip it over, you can see it here. And so these wings here are the lesser wings, which you see here. You have these big wings here. Those are the greater wings, which we see here. And as we flip it to the side, that's actually what you're looking at here with the lighter color pink. That's this side here. So this is the sphenoid bone disarticulated, not inside of our skull, versus in the back of the socket, that would be an articulated sphenoid bone. And so if we look at all those bones in order, so nasal, maxillary, lacrimal, ethmoid, and sphenoid, you can come up with some kind of mnemonic to put them in that order. The one I've heard is never, make, Lucy, eat, spinach, and that puts all of those bones right in order. All right, so let's talk about some features of that sphenoid bone since we just spent some time with it. We talked about greater and lesser wings. Here we have a little saddle. This is where your pituitary gland sits, and this is called the sella turcica. Literally translates to Turkish saddle. So right here, if you kind of picture somebody sitting on a saddle, they're going to stick their arms in these little holes here. Now, anytime you have a skull that you're working with, you can put a pipe cleaner through the holes to see where it goes and picture these things from different angles. This is actually where your optic nerve comes through. So the holes are typically for nerves and vessels. So we have the optic nerve going through a hole, so we'll call it an optic foramen. If we flip it around, we can see how that would take it right into the back of the eye within that eye socket. You have other holes within the sphenoid bone. Some of them are just named for the shape that they carry. So we have a foramen ovale because it's an oval shape. We have a foramen rotundum because it's a round shape. So foramen rotundum because it's the round shape. Foramen lacerum because it looks lacerated or cut. There's also a spinosum because it's the little spiny one. So the holes do have different names depending on what they're doing. Since we're talking about openings for blood vessels and nerves to pass through, let's swing back to the occipital bone that we talked about earlier. In the back of this one, and it's always hard to picture in a flat two-dimensional image, there are holes here between the temporal bone and the occipital bone. That hole here is actually pretty large, and it's for blood to drain from the head through what we call the jugular vein. And so we have a hole for the jugular vein, we call it the jugular foramen. If we move more internal to that, so I think of it as a little bit more protected, there's another hole here, and that's for the carotid artery. So that we want to protect because that's blood supply to the brain, and it has higher pressure. So we don't want that to get damaged. So that's going to be the carotid canal. So jugular foramen, and then carotid canal is actually in the temporal bone. As we work our way through some other features, let's talk about the maxilla. So the maxilla has some holes here. We have holes underneath the orbit, so the name's going to tell you that they're below the orbit. We have the infra for below or inferior, orbital for orbit, and then foramen, so infraorbital foramen. There's typically a supraorbital foramen, but if the bone doesn't form all the way around the nerve, what you're left with is a notch or a little groove above. So this would be a supraorbital notch. But depending on the skull, it could be a hole, so it could be a supraorbital foramen. Other things with the maxilla is this is where the teeth will come in. So we have little parts that stick out, so that's a process. These are going to be the alveolar processes. We also see alveolar processes on the lower jawbone, which is called the mandible. So we have them here. Other features of the mandible is that it's going to change directions. Once that happens, we call that a ramus. Off of that ramus, you have the C shape for articulation, allows the jaw to open and close. That's a condyle. So we have a mandibular condyle, just kind of like what we saw over here. We had occipital condyles because that's the name of the bone. On the mandible, we have the mandibular condyle. We have a coronoid process that helps us hold muscles, so it allows us to move that jaw open and close. And then there are two holes that we should be really familiar with. Ones out here in the front are called the mental foramen because this is the mental region. So if you're thinking a lot, I like to think you put your hands over your chin, so you're being mental, so mental foramen here. The ones in the back where you have nerves that the dentist is always trying to numb, that's going to be the mandibular foramen, and those come in the back. A few more things to walk through. So if we look through the nose itself, we talked about that inner wall here being the ethmoid bone. You can see it as well up at the top and as you look through the nose itself. So there's a plate that runs perpendicular up here and it meets a bone at the bottom called the vomer to help make up the septum or the divider in your nose. If you look at that plate from the top, this is called a cribiform plate because it looks like a little crib with a baby sitting in it. The trick is the baby's name is Krista, so this is a Krista Galli. And then we have this crib, so cribiform plate, at the top of the nose. Those little holes there, those are for the smell nerves. So the actual translation here is olfactory foramina. Olfaction is the name for sense of smell. Foramina is plural for holes, so it actually means smell holes. All right, so there's a lot of really fun things going on with the skull. There's one more bone that we haven't done yet, so let's flip it over and look from underneath. So as we're looking at the maxilla, we can see that green right here. It'll go under and it'll be this hard palate right here, and it's reaching these little bones here in red, and those are the palatine bones. So those make up the top of that hard palate. The palatine bones are being touched by something that's coming off the maxilla. Even though the process isn't going out of the face, it's still a process. It's something that's sticking off the bulk of the bone. So the maxilla has something reaching a palatine bone, so we're going to call this the palatine process of the maxilla. All right, that was a lot of information. I hope you're able to get your hands on a skull and find these things for yourself. Thanks for watching.